Friends, thank you very much. Thank you all for being here. Thanks for all the banners and thanks for all the enthusiasm. This is the third NHS celebration I've done in 3 days. On Friday, I was in Livingston in Scotland, working with them, campaigning with them to protect a children's ward, but also to ensure that we get a Labour government in Scotland to deliver the quality of NHS care that people in Scotland deserve. Yesterday, John Ashworth and myself and many, many others were at that magnificent march through central London and a big rally in Whitehall, again celebrating the whole principles of our National Health Service. And so it's quite fitting that here today in Tredegar, the birthplace and the constituency of Bevan, that we celebrate our NHS. Because what Nye taught us was that healthcare should be something available for all. He was the founder of the National Health Service in the post-war Labour government. He started his life in poverty. He became a miner, a trade unionist long before he became a cabinet minister. But he was also a thinker. He was a man of ideas and of principle. He did not go into politics for personal aggrandizement or power. Indeed, he was often heard repeating a very powerful maxim: the purpose of getting power is to be able to give it away. He went into politics to achieve his goal of living in a society free from inequality and poverty, because he had experienced himself all of that growing up here in Wales. It was his ideal that he applied to his brief as Minister of Health in the creation of the National Health Service, and all the battles he went through with all the vested interests and all the rich and all the powerful in order to create the National Health Service. And it wasn't about centralising or nationalising for its own sake. It was about ensuring that health care was delivered to everybody free at the point of need. The National Health Service Act of 1946 is quite an amazing document, and it raises the hairs on the back of my neck every time I read it, because it is so brilliant the way it's put. In its first paragraph it says, and I quote, "A comprehensive health service designed to secure improvement in the physical and mental health of the people and the prevention and diagnosis and treatment of illness." This was the purpose of the NHS, to establish healthcare as a right for all, not a privilege for some and the few. It's socialism in action. When I met President Barack Obama before he stepped down as president, I congratulated him on extending Medicare for more people in the USA. And he reached across the table, he said, "Jeremy, that is very, very kind of you to say so, but it's my greatest failure. I wanted, as president, to deliver health care for all." And so what I gave him was a gift, a book of what Keir Hardie would have said, another Welsh MP. And I gave him this book and explained Keir Hardie's life and explained Aneurin Bevan's life, and he said, "I can see that's where the inspiration of your party comes from." It was a wonderful comment of his to make, but our message has to be that everybody in every part of the world deserves the right of healthcare as a right, as a human right. And so the message that Nye gave here in Tredegar, when he said no society can legitimately call itself civilised if a sick person is denied medical aid because of lack of means. Society becomes more wholesome, more serene and spiritually healthier if it knows that its citizens have at the back of their consciousness the knowledge that not only themselves but all their fellows have access when ill to the best that medical skill can provide. For a generation, including mine, that had never known anything but the National Health Service, we have to remind ourselves what the fear of illness was before 1948. We want to be healthy. None of us want to be ill. We are afraid of terrible diseases. We are afraid of terrible conditions. We are afraid of accidents. It's a natural human condition. But none of us have a fear at the back of our mind that the care will not be there because we don't have the money to pay for it. I have a family member who lives in the USA who suffered a great deal from a very serious illness. She had good insurance and she's been well cared for and recovered. Wonderful. But she was the first to say to me, had she not had that insurance, she would not be covered. The family would have been bankrupted. The biggest cause of bankruptcy in the USA are medical bills. Remember, our health service matters, it's ours, and we're not giving it away to anybody. It is our most prized and popular institution, but we've got to look at it as it is today. And that's why there's so much anger all across the UK about the way our NHS has been treated by this Conservative government in Westminster. 8 years of austerity, 8 years of cuts to NHS budgets in England, and a rising tide of privatisation has seen more and more of our health services handed over to private companies so it can be run for profit and not for people. Indeed, as John pointed out, there are even private providers like Virgin Healthcare that express an interest in delivering an NHS service. Somebody makes a very correct decision to ask them to remove their interest and not any longer express an interest in running an NHS service. And do you know what happens then? That company, Virgin Healthcare, then takes our NHS to court and asks for compensation for a contract they didn't get because nobody wanted to give it to them. What kind of nonsense is that? Our NHS paying money to private providers for not delivering a service. This message, eventually, about our underfunded health service seems to have got through to the Prime Minister, Theresa May. She's now accepted the current state of affairs is not sustainable. Don't worry, this is not a paean of praise for Theresa May, don't get carried away. They've attempted to make headlines out of announcements of more funding, but after 8 years of cuts, short-term fixes are not even enough to paper over the cracks. They do not know where this money is coming from. They have no new funding for public health, mental health, capital spending or social care. The Conservatives are not serious about improving public health in this country. The proportion of our nation's wealth going into the NHS has fallen under these Conservative government. It's my pledge here today on behalf of the Labour Party, the next UK Labour government will reverse that trend. Bevan said the NHS was the envy of the world, but a recent major study has shown the service is now seriously behind the healthcare systems of other major economies in preventing deaths from heart attacks, strokes, lung diseases and cancers. It shows that Tories starving of the health service and having a genuine and negative impact on the NHS ability to cure major illnesses. The average spend across the UK is £3,100 per person per annum on healthcare. That compares to an average of £3,500 amongst major developed countries. £400 difference for every person across the UK is a major difference. In part, this is because the NHS is efficient and ever more efficient in a way of delivering health care, but there are other reasons as well. When these comparisons are made, I ask you to exclude the United States from them. Its privatised healthcare system costs twice as much and covers only half the population. Millions of Americans go without any health care whatsoever. But the Conservatives, they have taken NHS efficiency and cut it to its bones. It's left our NHS in record deficit, and left our NHS in record deficit as mental health budgets have also been cut. Nurses and midwives' bursaries have gone, social care budgets and for the elderly and disabled have been slashed, and more of our NHS has been privatised and handed over to a number of private operators, including Richard Branson. That's why, under a Labour government, we will restore the NHS to its rightful place as one of the best healthcare systems in the whole world, as Nye envisaged it to be. And we will no longer say that people in this country will have less chance of survival of heart attacks, strokes, lung diseases and cancer. We are the party that created the NHS when the Tories voted against it. And Labour is the only party that will properly care for the NHS and its workforce. Indeed, I want to take this opportunity of paying tribute to all those that work in the NHS and to say to Theresa May, you created the hostile environment against the Windrush generation. We, the Labour Party, thank the Windrush generation for your stoicism, your contribution, your dignity and your support for public services all across this country. The Tories cut the overall budget for the Welsh Government, and it is a tribute to Carwyn, Vaughan, Mark and all of those in the Welsh Government that spending on health and social care has been protected. Not only this year, but last year health spending per person grew by 5% in Wales. Well done, Welsh Labour. Well done, Welsh Labour. And I will take no lessons from Theresa May or any Tories on the conduct of the health service in Wales. We know it is in good hands. Good hands of people that believe in a national health service. The availability of free hospital parking, free medical prescriptions has been delivered by Labour in Wales and is ensured that people are not subject to hidden charges or taxes, which place an extra burden on patients, families and staff. Similarly, the Welsh NHS has been saved from the disruption of constant reorganisation which has occurred in England, and Welsh Labour has stuck to its principles in keeping the NHS here public, free from an internal market and privatisation, and without the involvement of disastrous PFI contracts in the hospitals. The next Labour government in Westminster will take the profiteers out of the NHS in England as well. And we will increase funding for the NHS by an extra £30 billion throughout the lifetime of the next Parliament. And that will be paid for and costed by asking the very richest 5% in our society to pay a little bit more. I do not glory in the levels of inequality across this nation, and that increase will ensure that patients can be cared for by a health service fit for the 21st century. We will introduce free hospital parking in England, just as you've done in Wales. It will be paid for, I think this is a good move, by increasing levies on private health insurance premiums. It's not very much, and it will mean that that stress of the cost of parking your car at a hospital car park when you don't know how long you're going to have to remain there is gone. We are the only party that will support the NHS staff, and I want to pay tribute to those taking action at the moment in Lee, in Lancashire, standing up against the privatisation of their services. Well done Unison, well done Unite, and well done all of you. Yeah, wave the flag, because I am also a Unison member. because they've been subject to a pay cap which resulted in a 14% real terms pay cut. This is a disgraceful way to treat the staff who keep our NHS going day in, day out. We will end the appalling cases of working nurses being forced to use food banks because they can't have enough money to buy food for themselves and their families. Just think about it. What has happened to this country that our health service nurses, some of whom need to go to a food bank just to feed their family? It is a disgrace, as it is that anybody should have to go to a food bank. So our ambition is not just to have the best health service in the world providing the best outcomes, but the best trained clinicians and nurses, which is why we will reintroduce bursaries for health-related degrees. We're losing too many of tomorrow's nurses because the government is too mean to pay for the bursaries of today to ensure they get that training. I spoke to a group of graduates, or those just about to graduate from Worcester University on a nursing course. There were about 25 of them there. I asked them how the course had gone. They were very pleased. They'd all got jobs. They were delighted to work in the NHS. And I then said, can I ask you one last question? They said, please go ahead. And I said, how many of you could have done this degree if you had not had the nurse bursary? Do you know how many hands went up? One. And that was only because her husband was in a good job and was able to pay for her to do it. What a crying shame and waste that we're losing the skills of a whole generation of people who want to work in our National Health Service. We created the NHS, and what every Labour government has had in common is that it has protected and improved our NHS. Every single Labour government has, and the next one will as well. Bevan created the NHS as part of the post-war government's very radical agenda to create a comprehensive welfare state. They wanted not just to improve the nation's health, but to end the poverty that so much of the population had been forced into after the Great Depression. Remembering that extreme poverty in South Wales, the great poet Dylan Thomas, and he's a wonderful poet, as so many other poets from Wales are so wonderful. But I just want to quote what he wrote in 1943, recalling a scene that would be familiar to many. Staring at the hunger and the shut pit head, nothing in their pockets, nothing home to eat, lagging from slag heap to the pinched, packed street, remembering the procession of old young men. It shall never happen again. That's what Dylan Thomas wrote, remembering the Depression. So Bevan and that whole generation of socialists did commit to it never happening again. They sought to combat Beveridge's 5 evil giants: squalor, idleness, disease, ignorance and want. They knew then, just as we know now, that you have to be truly transformative to make a difference to people's lives. And the next Labour government, I promise you, will be truly transformative. You cannot have a healthy society without it also being a prosperous society. And there is mounting evidence to support this, showing that austerity and inequality are killing us. Ill health and deprivation are too often predetermined by the accident of a person's background or the geography of where they live. Men in the most deprived parts of England today will have nearly 20 fewer years of lives than those in good health. In Scotland, it's 26 years. And this isn't about rich London and the South East versus the rest of Great Britain. There is massive inequality even in the wealthiest parts of this country. Take the Royal Borough of Kensington and Chelsea, for example, the site of the Grenfell Tower tragedy just over a year ago. There, in that borough alone, the richest borough in the whole of Britain, life expectancy is 14 years lower for the poorest residents. People living in the most deprived areas are 5 times more likely to suffer from cardiovascular disease, 70% more likely to get lung and cervical cancers are diagnosed in those very same areas. It's an old cliche, but it's true. Prevention is better than cure. Nye recognised that. The NHS treats illness, but our unequal society causes much of that illness. So we will be as dedicated to the prevention of ill health as we are dedicated and compassionate to the treatment of ill health. NHS professionals recognise this. Earlier this year, NHS England said, and I quote, "Inequalities and life expectancy and healthy life expectancy are nearly all worsening." We are the 2nd or 3rd richest economy in Europe. Yet, out of the 28 nations in the European Union, female life expectancy is 17th. For years, people were living longer. Life expectancy was increasing. That has now ground to a halt. And in some parts of Britain, life expectancy is actually falling. This is unprecedented at any time in the history of this country. And it cannot be tackled by the NHS alone. We need the whole government, we need the whole of society to deal with it. Tackling poor housing, tackling poor education, low pay, tackling poverty. There are today 400,000, get that figure, 400,000 more children living in poverty. Over 4 million in total since 2010. In other words, under the Tories and the Lib Dem coalition and the Tories on their own, 400,000 more of our nation's children are now living in poverty. That's what austerity has done to the poorest people in this country. It's been estimated child poverty costs the country 1.5 billion per year through increased need for acute health care. That there is an economic cost, but it's the human cost. Infant mortality would be reduced by 1/4 if all children were born into the lowest areas of deprivation. Nye and the government that he was such an important part of knew that improving living standards for all meant decent homes for all, decent education for all, decent living standards, in short, decency for all. Nye was also the housing minister that did so much to improve the quality, the quantity and the type of housing that was built in that wonderful 1945 to 51 Labour government. The Labour government that I want to lead will provide that, and we've begun to set out how. Our approach will be a society-wide mission against the causes of ill health and deprivation. We can only tackle the challenges of inequalities affecting life chances and ill health if housing, economic transformation, education and social care and our NHS are working together. Take air pollution, for example, a major problem in many of the UK's big cities and plays a big part in up to 5% of all deaths in Wales, up to 8% of all deaths in London. It's a genuine disgrace, therefore, that the British government has decided to invest in projects that harm air quality instead of investing in new green technologies such as the Swansea Bay Tidal Lagoon. We know that the 2 biggest changes we need to make to reduce health inequality are increasing the incomes of those stuck on low wages and improving early years provision for children to give them the best possible chance in life. The last Labour government brought in the Sure Start programme. It was a massive achievement, and I want to pay tribute to the late Tessa Jowell for setting up that programme and what she did in achieving it. Unfortunately, again, the comparison comes in Over a third of Sure Start centres in England have been closed since the Tories came to power, and in stark contrast in Wales has given us the Flying Start programme providing childcare, health visitors and parenting support. Well done, Labour Wales! The importance of early years in helping all aspects of a child's future, education, health and social development, is why the next Labour government will not just halt the closure of Sure Start, we'll give new funding to the scheme. But we're also going to create something that I want to be the legacy of that government, a national education service. It was Bevan's dream to have universal healthcare for all, those who need it, from cradle to grave. It's my dream, it's our dream. I want it to be everybody's dream, to provide universal education from cradle to grave for all those who want it. Just as the NHS provides healthcare as a right for all, the National Education Service will change the attitude towards college and university and further education as being a right, not a commodity to be bought and sold. And it will provide a range of education free at the point of use up to and including degree level, as well as allowing the extension of free childcare to all 2-year-olds which across the whole of the UK, which we know makes a very significant difference to their life chances. It's this belief in the early years sector that has led to our ambition to have the healthiest children in the world, and a new 250 million children's health fund, and a new government index of child health to measure our progress on this compared to other countries. A welfare state that provides good quality of life for everybody alongside the NHS, an education system and social security. And this is actually a pragmatic move. Will not only protect existing housing social stock for future generations, but will encourage the building of new houses for a growing population. Indeed, it's meant that the Welsh Labour councils are actually beginning to build new council houses, a move which must be embraced and accelerated if we are to deal with the housing crisis. So, the next Labour government will re-establish a Department of Housing with the goal of tackling the housing crisis, which the Tories have caused with the lowest level since the 1920s. And we will end the scourge of homelessness and rough sleeping, which is rising year on year. I cannot be the only person in this beautiful park that feels there's something morally wrong with a country that walks by on the other side while fellow citizens huddle around stations trying to collect enough money to get into a night shelter. We want everyone to have an opportunity to have a home of their own and stop children growing up in cramped, substandard accommodations. The central duty of a government, any government that is serious about the population's well-being, will be exactly that. This is our commitment to build a society that works, a society that works for everybody. We know, all of us know, that change is needed. If we're serious about ensuring that our NHS is here for another 70 years, then we must support it, end privatisation, and ensure we tax appropriately to give the NHS the funding it needs and deserves. If we're serious about improving the nation's health overall, we must improve the nation's pay and people's living conditions, reduce poverty and inequality. If we're serious about fulfilling Nye's original dream of creating a society that looks after everybody, then we have to transform our economy so it doesn't just work in the interests of a few. I don't want to live in a society where anybody walks by on the other side. We must include everybody and exclude nobody. They were Nye Bevan's values. They are the NHS's values. And you know what? They are Labour's values. Thank you very much.